Listeners, we are here with our 100th episode, and thanks to all of you for the wonderful support that you have given us so far. And today, we are going to be talking about a topic that's a focus and an irritant for most of us. Imagine you are about to give a big presentation at work and your stomach feels like a knot, and then the cramps hit. This isn't just pre meeting jitters, this is the reality for millions living with irritable bowel syndrome or IBS. But what exactly is IBS? Joining us today to shed light on this common yet often misunderstood condition is Lee Walker, an award winning clinical hypnotherapist based in the UK. Lee specializes in helping individuals suffering from IBS and anxiety reclaim their lives through evidence based hypnotherapy techniques. Let's dive into the world of IBS with Lee and explore how we can navigate this condition towards a path of healing. Welcome to the show, Lee.
Thank you very much for inviting me. It's a pleasure to be here.
Thanks a lot. Thanks a lot for accepting our invitation and helping us with this often not talked about topic, IBS, but where millions suffer from this problem. But Lee, before we get into this, I would like to know more about you as an individual, your journey, what brought you to hypnotherapy, and why specifically IBS. So if you can, share with us about your journey so far.
Yeah, so I guess my journey started about 20 years ago when I was in a managerial post in education. I worked in education, and suddenly, out of nowhere, I developed. At the time, I didn't know it was IBS, but just kind of stomach pains, bloating, all the other symptoms of IBS, and went to my doctor, diagnosed eventually as having IBS, and given the kind of normal drugs that doctors give you to help you manage it, and nothing was really helping. And progressively over about 5 years, it was getting worse and worse. And somebody just in a conversation said to me, did I try hypnotherapy? And I wasn't really sure at that point what it was. And so, I went and found my local hypnotherapist, went to see a lovely lady not far from where I lived. And within about 6 sessions, all my symptoms had disappeared. And I was just utterly amazed. I was just like, how has this happened? How have I gone from 5 years of agony to within 6 sessions, complete freedom? And I spoke to the hypnotherapist, and she just explained to me a lot about what hypnosis was, and she taught me self-hypnosis, and my kind of journey into hypnotherapy began there. I became a massive advocate of hypnotherapy, was recommending it to lots of people that I knew at work and my family. And eventually, about 8 years ago, I decided I really wanted to become a hypnotherapist. So I trained, I qualified, I've been a hypnotherapist for the last 8 years. And because of my journey, because my own story, I wanted to specialize in IBS. And I think it helps me have a lot of empathy with the people that I work with, because I've been there. I understand what it's like to live with IBS and the difficulties they face. So that's kind of where I started, where I am today.
Amazing, amazing. Thanks a lot, Lee, for sharing that journey with us. Just, it piqued my interest. If you can help, how long were these 6 sessions, spread across? Were they across 6 weeks, or what was the duration in which these 6 sessions were taken?
Yeah, so each session was an hour,
Okay.
and they were, spaced maybe. I mean, it varied really, down to me to kind of indicate how often I wanted them. Some were a week apart, some were a couple of weeks apart. But as I started to improve,
Mhm.
they started to be spaced out a bit more. So I think on average, I would say they were a week apart. And what was very helpful that my hypnotherapist gave me, she gave me recordings so that I could continue to practice the hypnotherapy at home
Yeah.
in between the sessions. So, whilst I was having, a session with my hypnotherapist once a week, I was also continuing to incorporate the hypnosis into my daily routine by listening to the recording that she gave me. And that's something that I continue to give my clients that I work with now, so they all get, a recording that they listen to between the sessions. And yeah, I'm sure I'll talk about that a bit more, but yeah.
That's amazing. That's amazing. So, Lee, before we get into this, the journey of understanding IBS, why don't we also help our listeners understand what exactly hypnotherapy is and
Mm.
bit about its origination and how it can help other people and other ailments out there apart from IBS, if they can, its benefits can be, used across different horizon.
Sure. So hypnotherapy is a therapeutic technique, just like any other kind of psychological therapy, but we use hypnosis. So hypnosis is a technique that's been used for hundreds of years and goes back to kind of mesmerism. That's probably the origins of hypnosis. And then over the hundreds of years, it's kind of developed, and we use it therapeutically to help people overcome a wide variety of different issues, some physical such as IBS, some psychological such as anxiety. And yeah, I mean, there's kind of different approaches, there's different schools of hypnotherapy. The type of hypnotherapy that I practice is one called solution focused. So we focus on the solution, what the client wants to achieve, rather than understanding the problem, as it were. It's kind of solution focused rather than problem focused. So it's very it's not really about finding the root cause of where the problem came from, why the problem exists, how to manage with the problem or anything like that. It's very much about using their unconscious mind, as it were. So hypnotherapy is about making those kind of unconscious changes. So briefly talk about the mind. We have our conscious mind, which is anything within our awareness, and then we have our unconscious mind, which is all those automatic processes, all those automatic behaviors, habits, things that we learn to do over time, and then we habitually carry them out. And for a good reason, because it saves us a lot of energy. We don't have to keep learning to do something time and time again. We learn to do it once, we store it, and then that response becomes automatic. So a lot of what we do as human beings is unconscious. It's not we're not sitting there having to learn to do something over and over again. And with these kind of mental shortcuts that we take all the time, called heuristics, which are based on, I guess, a lot of kind of probability, right? That based on a limited amount of information, what is most likely going to be the outcome in this situation, and how would we respond to that? And that's all done kind of pretty much unconsciously. So that kind of, we in hypnotherapy work with the unconscious mind, as it were. And to answer the other element to your question, which was what other things can we use hypnotherapy for? Well, as I touched on, anxiety, which actually does feature within IBS. It can be used for fears and phobias, such as fear of flying, animals, cats, dogs, spiders, snakes, all that kind of thing. All those kind of irrational type fears and phobias. Stop smoking, so habitual things like nail biting, pulling hair, smoking. To some extent, it can be helpful alongside other therapies for addictions. And probably the oldest application of hypnotherapy is in pain management, the ability to either reduce pain, manage pain, or in some cases remove pain. Right. So it's that's probably its oldest application if we kind of go back through the records of research. And in some countries around the world, they will offer people that are going in to have surgery, major surgery, the choice: would they wish to have a general anesthetic, or would they wish to have a local anesthetic and use hypnosis? So there will be a hypnotherapist that will, and there's, in the United Kingdom a few years ago, there was a documentary where somebody had open heart surgery with just a local anesthetic and used hypnosis. And the interesting thing about that is that all the studies that have been carried out on using hypnosis, in surgery, is that the outcomes are far better, right, for the patient in terms of less post-operative infection, quicker recovery rates. And that is largely due to the fact that the patient is an active participant in the process rather than passive, and they're engaged in it. So in terms of IBS, I mean, there's a big component of that is pain. So we do utilize the power of hypnosis, even within IBS, to help people manage pain and reduce it and eliminate it in many cases.
Thanks a lot for sharing the details on hypnotherapy. That's quite elaborate. Now, let's start with understanding the symptoms of IBS and what exactly is IBS.
So IBS is a disorder of the gut, and it's a chronic condition. It varies from country to country, but anywhere in the region from 20 to 30% of the population will suffer with IBS. It tends to affect women more than men, probably twice as many women as men. It affects young and old alike. Recently, there's probably an increase in the number of older people starting to suffer from IBS. It's a disorder of as I said, of the gut, the gastrointestinal system, and it's quite different to other disorders. So there's other disorders such as IBD, inflammatory bowel disease. IBS stands for irritable bowel syndrome. So the gut is irritated. Then there may be some inflammation, but it's not inflammatory bowel disease. And it's kind of an overactive, hypersensitive gut, which causes major discomfort, affects lifestyle and such like that. So it's not something you can pass on, so you can't catch it from somebody. It kind of originates in different ways. Some people find that it starts from a major stressful event in their life, whereas others, then it might stem from food poisoning or some other kind of event. So it doesn't always start in the same place for people, and people's triggers can be different. So generally people develop food intolerances rather than food allergies. Again, in allergies there's an immune system response, whereas in IBS it's not an immune system response. It's just the gut has become hypersensitive and intolerant to certain types of food.
Only if you can, share some type of symptoms, because you said there are a lot of other issues related with gut, and how can an individual identify or understand that they are at the early stages or suffering from IBS? How can they really, navigate that path and decide, okay, I need help with IBS?
So typically, here in the UK, I mean, it will vary from country to country, right? But
Yeah.
in the UK, somebody who has some form of gut problem, I mean, if you're talking about symptoms, then, as I mentioned earlier, the major ones are pain. So pain within the gut, in the stomach or the intestines. There'll be diarrhea in some cases, constipation in some cases, bloating, excessive gas, indigestion, loss of appetite, nausea, and heartburn, other major symptoms associated with IBS. But so if somebody is suffering from any of those symptoms, they will typically go to their doctor, and they'll say that they're suffering with these symptoms. And then in the UK, our doctors follow a process of elimination typically. So they'll aim to eliminate probably more severe problems such as bowel cancer, Crohn's, colitis, celiac disease. And so they typically will aim to eliminate those first. And if all of those tests for bowel cancer, Crohn's, colitis, celiac come back negative, and other kind of tests that are done, blood tests, maybe endoscopies, things like that, if they all come back negative, then typically what happens is that a person will be diagnosed with irritable bowel syndrome if they meet what are known as the Rome 4 criteria. So there are a set of medical guidelines that doctors use. They're called the Rome 4 criteria. And to meet the Rome 4 criteria, a person has to have recurring abdominal pain that they have had on average at least 1 day per week in the last 3 months with associated change in the frequency and appearance of the stool, and that need to have started within the last 6 months. If all the other tests come back negative in terms of other diseases of the gut, then they'll apply the Rome 4 criteria, and that if someone meets that, they will be diagnosed with irritable bowel syndrome. And to be, kind of, in short, it's a case of, well, we don't really know what's causing this, right? It's you've got a problem, but we can't find a source of it. And at that point, the remedies will be largely pharmaceutical. It will be to manage any spasms. So within the gut, there's muscle, smooth muscle. So there'll be to manage the spasms, manage any bloating, any excess gas, any diarrhea, any constipation. And it's about managing the symptoms. And what tends to happen at that point is that, if someone responds well to the medication, their symptoms improve and the IBS goes away, right? For many people, that isn't the case, right? It's kind of, it's not dealing with the root cause of that. And if someone doesn't respond to the medication, within 12 months, they are then referred to as having refractory IBS. So they've continued to go back to the doctor, and the medication isn't really preventing it from reoccurring. They'll then be classified as refractory IBS. And at that point, here in the UK, the medical guidelines encourage the use of psychological treatment, such as cognitive behavioral therapy, CBT, or hypnotherapy. And by far, the most effective treatment, and I can talk a little bit more about this if you'd like me to, but the most effective treatment for IBS, especially refractory IBS, is hypnotherapy. Study after study from well-known universities have reported success rates of above 75% of the people that have participated in hypnotherapy. And the largest study I'm aware of, which came out in 2015, had over 1,000 patients in that, and the mean success was 76% of those. So 760 people within that group all had all IBS symptoms, and that's one of the best thing about hypnotherapy is it improves all IBS symptoms. It doesn't just improve one or two; it improves all of them, and it's long lasting. It's for up to years after they've completed the hypnotherapy. And in my case, I'm just using my case as an example. I've been free of IBS for 20 years, right? When I had it, I was eating a very limited diet. Now I eat pretty much whatever I want, right? Yeah, there are days when, like everyone, my stomach doesn't feel great, but it's not IBS, right? Yeah. But, I'm not saying I have this cast iron gut, but, and that's the same for many, many people.
I guess our listeners would have got an elaborate idea on how to actually identify their symptoms that are around IBS. Because if I talk about the Indian ecosystem, as far as I'm aware of it, IBS is not that very a prevalent term in the medical industry, as far as my knowledge serves me. I've not heard many of my friends or people in the inner circle saying that they are having IBS. At max, I hear them saying having constipation or diarrhea or acidity, gut reflex. These are some of the issues I've most often heard. But yes, when I'm talking to experts in the US or the UK, I do often hear the term IBS out there. And yep, that's what piqued my interest. And I'm really looking forward to this topic. So, Lee, can we say that IBS is a lifestyle issue?
Absolutely. One of the things about IBS is not many people like to talk about it, right? People that are suffering with IBS, typically there's an element of embarrassment associated with it, right? Because, especially if they're worried about needing a toilet, right? Especially if you're suffering, so there's three broad categories of IBS. There's IBSC, which the C stands for constipation. So that's your predominant symptom. There's IBSD, which is your predominant symptom is diarrhea. And then there's IBSM, which is mixed. So you may fluctuate from constipation to diarrhea, but in terms of bowel frequency. So, if somebody is suffering with IBS-D, which is the diarrhea type, they will be hyper. And when I say hyper, I mean really hyper aware of where the toilets are, needing a toilet. And their life will be dictated by where is the nearest toilet. Right? To the point where some of my clients that I've worked with will not leave their house unless they know exactly where the toilets are on the route that they're taking to their destination. And getting a train can be the most difficult thing for them, because if the train doesn't have toilets, what are they going to do, right? And it can be, I've worked with clients who've had to give up their jobs because they're just like, getting to work is too traumatic. So in terms of lifestyle, it can destroy someone's life. And to be at work and constantly, I've had people who've their stomach is making these sounds, right? And they're in a meeting and they're thinking, everybody can hear my stomach. Oh, this is very embarrassing, right? And the embarrassment associated with being in public, going out for a meal with friends, can be, again, one of the most traumatic things, because they're like, well, what if I need to use a toilet, and so on and so on. It really does. And this is kind of, why people don't really talk about it, because they just end up a prisoner in their own home, right? They don't like going out. They're embarrassed about it, and it becomes this kind of silent kind of issue that people don't want to talk about it. And from the other side of it, from lifestyle, well, diet becomes a major thing, because people are constantly trying to find their triggers for what's causing the IBS. Diet becomes very difficult, especially if they're going out, seeing friends, family, and things like that. And they're again worried about every meal. What effect is this going to have on me? How much pain am I going to be in to my gut? So it's pretty devastating, to be honest. And it typically gets worse and worse over time, right? It doesn't get better. And people, end up following very restrictive diets. One of the kind of popular diets that people tend to follow is what's called a low FODMAP diet. It is a particular sugar that's found in many foods, and some foods are higher in this particular sugar, and some are low. And some people say that following a low FODMAP diet does help. And then there's a whole issue with fiber, right? It's about people, again, general advice is to eat a high fiber diet. Well, if you're suffering with diarrhea, IBS, adding more fiber to your diet can be pretty devastating. And not all fiber is equal. Is referred to as soluble type fiber and insoluble type fiber. So generally, insoluble type fiber is worse for, and surprisingly, bran fiber makes IBS symptoms worse. The best type of fiber for someone with IBS is soluble, and oat type fibers in oat. You can buy it, comes from a plant extract. It's called psyllium, and you can add it to water and drink it, and it basically expands and creates a gel within the gut and makes the passage of food through the gut easier. So it's quite a complex area, really, and it becomes a bit of a minefield trying to work out, what can I eat, what can't I eat. Caffeine tends to be a trigger in some people. Alcohol can be as well. Red meat can be. It goes on and on and on, right? It's people go round and round in circles thinking, oh, I found a trigger, and then they eat it and they actually don't find it has any effect. And then another time they'll eat it, it does have an effect, so they're never really sure. Yeah, again, with exercise, something like exercise, moderate exercise is generally preferred to strenuous. Strenuous exercise can make IBS symptoms worse than, but there's no hard and fast rule of all this. It's going to vary from person to person. Someone might find one thing triggers their IBS symptoms, someone else might find it has no effect on their body whatsoever.